Welcome everybody to Revive Health's Daily Briefing Live for Tuesday, May 19th, 2020. This is our 30-minute review of the latest, most important news, resources, and advice for health system marketers and communicators who are dealing with the COVID-19 crisis. I'm Chris Bevelo, Health Systems Practice Lead at Revive Health, and your host for the show. I'm joined as usual, most of the time, by Chase Kleckner, Senior Marketing Manager at Revive Health and our show's producer. Hello, Chase.
Hi, Chris. Good to see you.
Good to see you too. And we are also joined by Melissa Tizon. Melissa is Associate Vice President of National Communication for Providence St. Joseph Health, one of the largest health systems in the U.S., serving 7 Western states. Before joining Providence in 2012, she led marketing communications for Swedish Health Services in Seattle. She attended the University of Missouri School of Journalism and worked briefly as a journalist in the Seattle area before going into healthcare communications. She is also an old friend and colleague. I think we actually met in 2012 when you made that transition from Swedish to Providence. Is that right, Melissa? Does that sound right to you?
Yes. Yep. That was exactly the time.
So like 8 years ago, maybe 8?
Yeah. Wow. That's crazy.
It is a long time. Thank you so much for joining us.
Thanks for having me.
Yeah, very much looking forward to digging in with you in a little bit. As with each show, we will plan on covering the latest news on COVID-19, how it relates to marketing communications in the hospital and health system world. We'll highlight a couple of resources. And most importantly, we're going to be sharing what we're seeing and hearing from MarCom professionals across the industry. Today, more specifically, related to Providence with Melissa as our guest. So we want this to be an interactive experience as much as possible. So if you have a question for Melissa or myself or Chase as we go through the program, just put it in the Q&A queue in Zoom, and we will get to as many as we can as possible at the end of the show. You can also use the chat function to talk to other attendees. Chase will be using that to place some links to content we're talking about. But if you have a question, make sure you put it in the Q&A queue specifically so we can see it and address it. Remember that you can subscribe to this podcast on iTunes, search for Revive Health Daily Briefing Live. As always, we'll post a video recording of the show this afternoon, which you can find at our website at thinkrevivehealth.com. Go to our COVID communication hub, which is thinkrevivehealth.com there's a slash in there, thinkrevivehealth.com/COVID-19. A couple of other important points before we start diving in. We are not experts on COVID-19, so not a place to come for medical or scientific advice or resources, but we will have some opinions on marketing and communications related to the COVID-19 crisis. Just make sure that you take that in the context of your own situation, given everybody's organization and community is different and how COVID is impacting our organizations and communities are different depending on where you're at. So with that, we start with the news, and we always start with the case count. We do that just to keep an overall perspective on where we're at with this crisis. And that helps us kind of keep everything we're talking about in the right context. We use the Johns Hopkins tool on the show. And when I refreshed at the top of the hour, looking at global case counts, we're at 4,836,329. And in terms of global deaths, we're at 319,213. When we look at the United States, which is now roughly about a third of all cases, we're at 1,510,988 confirmed cases, and we are at 90,432 deaths. One thing I will note is yesterday I mentioned that on the tool and many other places, you can see kind of a daily count. And I think I fell for one of the oldest data traps in the book, though not Johns Hopkins wasn't trying to intentionally mislead me, but I said that the looked like we were on a decline of about 20 or 30%. But obviously that decline depends on how you look at the data. And I'm looking at a chart that looks at data on a weekly basis. Obviously, if you stretch that out or you condensed that x-axis, that degree would vary. So you can make data look really dramatic in its changes or more flat just depending on how you stretch out the X or Y axis. I know that, but I shouldn't have gone out there with some kind of 20 or 30% decline based on a visual. Instead, it should be based on actual data, which I don't have in front of me, but just wanted to clear that part up. Another thing we want to touch on just quickly is there was a story that was posted in our agency. Actually, it hit Axios today, and Chase will provide a link to it. The headline says, spine and joint procedures have taken a dive during the pandemic. And really what it does is it looks at least at the top of the article, there are 9 service lines, I guess I would call them. And they are each individual charts that compare the number of hospital procedures from March 1 to April 15th this year compared to last year. And so basically what you see is the level of decline from last year to this year. The most pronounced is in ophthalmology with a 50% reduction in procedures. Excuse me. And you can see some of the others. Cancer is one of the least at 18%. And I think just from our experience with clients, a lot of systems, even though they've closed many procedures, they have kept cancer care open for obvious reasons as much as they can. Cardiology, it's down 35%. So that shows you that even in areas that are more emergent, again, elective procedures is such a weird term. The only one that's interesting to me, this is a surprise to me, I guess, they're all interesting, is obstetrics, which is down 17%. I mean, I don't know if that means 17% of the people are just having their babies at home. If there's some other demographic trend that would account for, because you don't have a choice with having a baby. These other things are all, you can push off even, other than emergency situations, but you can't push off having a baby. So not sure what that actually means. Melissa, you've had a chance to look at this. Do you have anything you want to add, even from a Providence perspective, on the drop in procedures?
Yeah, I mean, what you were saying is about elective surgeries being such a weird term. That's so true because, by government orders, we had to delay any surgery that was non-emergent or non-essential. But if you have a spine problem or a hip or joint problem that you've been suffering with, to you, that's not necessarily elective. It's something that you really want to get taken care of. So those numbers do seem consistent with what we've been seeing. And another thing, is I would think that especially related to some of the joint procedures is that opioid prescriptions have had to go up during this time because as you delay surgeries, people are experiencing pain in the meantime. So that's another consequence of all of this. And, certainly it was the right thing to do because we needed to conserve PPE, like all those, everything that they wear in the OR, we needed that for to prepare for a surge in COVID patients. So it was the right thing to do, but it did come at a cost because people were waiting for care that they were relying on. So
yeah. You bring up the opioid increase. There's so many kind of secondary impacts.
Yeah.
So that's one where we might see an increase in opioid addiction just because people have had to use it as a substitute for procedures. Obviously, we've got a lot of people that have had to postpone or have selected to postpone critical care that is also going to end up, with more acute situations. And the other thing we talked about, and we're going to talk more about this tomorrow, I think, on the show, the idea that we've been spending a lot of time talking about acute procedures like surgeries, but there's been a lot of preventative, a lot of kind of what we call top of the funnel care offerings and procedures and situations that have also been postponed. So if you think about, the typical, okay, somebody takes an online screening, it raises a red flag, they go in to get a real screening that leads to a consult, which leads to a MRI, which leads to the need for surgery, right? So just as a kind of a typical thing. Those surgeries that were already scheduled have been put off, but so have all the other things I just mentioned. And so that can have a real impact downstream for people that aren't getting that preventative or diagnostic care they need to uncover the issues that undoubtedly are out there. So the other thing I'll point out from this, and then we'll move on, is it goes into a little bit of detail that I think is kind of interesting. It talks about how the data, which is from Strata Decision Technology, just to give the source, shows that hospitals have almost completely stopped knee replacement surgeries in April. And they've dropped in total by more than 68% for that whole 6-week period. Hip replacements are down 52%. And I would guess that the difference there is hip replacements oftentimes are caused by falls, by traumatic incidents, more so than knees. So I'm assuming that's why there's, a little more hip replacements being done than knees. But that's just another example, right, Melissa, what you're talking about, where you could have a really screwed up knee, but it may not be urgent enough to get you to come in during the crisis. And now we need to get you in as soon as we can, as soon as we're able, right?
Yep, exactly.
All right. So one more thing, and then we're going to dive in a little deeper with Melissa here on her experience, both personally and at Providence. Just a reminder to visit our COVID-19 communications hub. That's at thinkrevivehealth.com/COVID-19. As I mentioned, recordings of the show. We also have content from our biweekly e-newsletters that we put out. And then a lot of research that we've been doing, so you can find those reports. Chase, do you know, I know that when we had Sasha on last week, we promised to have a report from the qualitative interviews we did that Sasha talked about. Can you give an ETA when that's going to be up and ready for folks?
Yeah, we're looking at end of day tomorrow.
Okay.
That'll be up on the site.
Perfect. So if you're looking for that, again, that's just a report on 13 interviews we did that was a deeper dive into some of the research that's already out there you can read. So all of that is there. Please give that a visit. All right, Melissa, let's dive in here. First, I want to ask you, because we've known each other for so long. We're friends. I follow you on Instagram, and you've done such a good job. Like you live right in the heart of Seattle. So you've done such a good job just on a personal level, kind of sharing pictures and videos from, what is really the first epicenter for COVID-19 in the US. What's it, just at a personal level, what's it been like to live in Seattle these last couple of months?
Oh, it's been intense and surreal. Providence got the first patient on January 20. I mean, I remember Sunday night getting a text message from our chief clinical officer saying that we have a confirmed case coming in. And since then, it's been pretty nonstop. So we had a head start before everybody else. And the big tech companies in town started keeping their workers home before anyone else. And so I remember just probably the first week of March, I live in a pretty busy part of Seattle, and just looking at the street, and there was no one. Normally this place is so packed, and there was just no one in the streets. And so I just remember taking that picture and posting it on Instagram, because I don't think any other part of the country understood what was happening. And I just wanted to just show people that this is getting serious. So yeah, it's been nonstop. I think, as the month of March progressed, there were people across the country were catching on and just wanted to know much more about what we were doing. So I was getting media calls from the East Coast. I'm, on Pacific time. So that my phone, like clockwork, would start ringing at 6 a.m. We'd be going till 9 at night, just, trying to be as responsive to the news media, to all of our audiences, the news media being one, internal audiences being another, but just really trying to get communications out, because we just felt like that was incredibly important. And especially what we were hearing on the news, it was always an extreme of either the sky is falling, it's gloom and doom, or this is all a hoax. It's where are we in the middle of, so that's why we just felt like it was really important for Providence, being at the epicenter, being on the front lines, and having a perspective of what was really happening, to be out there sharing this perspective and making sure people had real information with no agenda, with no political agenda. Just, these are doctors who believe in science, and this is their perspective and what they're seeing. This is what our data is telling us. We just really felt we had to do that for the rest of the country, and, especially for the communities that we're in.
Okay, so you guys were kind of first to experience this. Real quickly, just kind of help people understand where are things now with COVID? I mean, are you really coming out of it? From what I understand, Washington has clamped down pretty tightly from the beginning as a state. But where are you at with COVID impact, and where are you at with kind of reopening things? Because we talked before the podcast about, you can kind of see Pike's Fish Market from where you live, and we were joking how that's normally just, and anybody who's visited that in normal times can understand it's just packed, right? And you mentioned that even now you can walk through there sometimes and not see anybody. So give us just a little bit of, like, since you were ahead before, where, like, this should also tell other people, like, maybe where we're headed in different markets.
Yeah, so we believe that we're past the surge. In fact, we're not even sure whether we had a surge. I mean, we did have a lot of cases, that's for sure, but I don't know that it actually hit the numbers that we were told it was going to hit. Regardless, we're past that initial intensity, and so we're having to, to become accustomed to living in a world where we don't have a vaccine yet, but we still need to care for patients, and we need to get back to patients and make sure that we're keeping our caregivers, our people on the front lines, and our patients safe. So we're living in that in between world. And then the city of Seattle and the state of Washington, I think they've done such a good job at social distancing. I think that's the reason that we didn't hit the surge. But just everybody is taking it extremely seriously. I think in other parts of the West Coast, or even other parts of the country, you may not see it quite as much as you do here. But people are adhering to all of that, and the orders are still in place, so we still have to shelter in place. But yeah, you still see people on the streets. It's empty.
Okay. So talk a little bit about how you've approached reopening, right? So you just mentioned that it's something that I'm pretty sure, I think I read yesterday that there was only 2 states that weren't at least reopening to some degree. From a hospital health system care perspective, I'm not sure which states are still kind of keeping the ban on elective surgeries in place as we speak, but the vast majority, if not all states, have opened that up to a degree. Talk about how you've dealt with that at Providence. I mean, first of all, you're a massive system. You cover 7 states, so you're dealing with very different geographies and situations. But what can you share about the philosophies and maybe some of the logistics that have guided how you're reopening non-COVID patients?
Yeah, so total, we've seen about 1,400 COVID plus patients, inpatients. So that's what we saw over the last 2 months, and compare that with 110,000 people who we've had to delay their surgeries, which is incredible. So we are anxious to get back to them, because we know that there are a lot of consequences from a health perspective if the care is deferred much longer. But so in most of our markets, we've reopened services as of May 1. And it's a gradual reopening. There's just a lot of logistics that we had to make sure were in place, and we feel really good about that. But getting personal protective equipment was the most important thing. And we've worked really hard to really shore up that supply so that we can make sure that everybody is protected, because we can't move forward if we don't have all of that in place. So that's been a key part of the logistics. And just really making sure that we're getting back to the healthcare needs community. And then at the same time, there's the financial impact of it. So, I don't think people really understand, even though hospitals were open and were considered essential workers, the fact that we had to close all of the elective surgeries had a huge impact. So if you wanted to use an airline analogy, taking surgeries off the schedule for a healthcare system is akin to grounding airplanes. There's just no money coming in the door. So that's, part of it. Certainly the health of the community is the number one, that's the mission, but then also ensuring that we can get back to financial viability by getting those surgeries back up and running. That's another key piece of it. And then again, as I said, we need to make sure that all of those logistics are in place, the PPE, the testing, the social distancing within the facility, just, all of that. And, one of the things that we are also doing is just, because there's a lot of anxiety. We have people on the front lines who are just coming in every day, just doing incredible work, but, they have anxiety around that. And so one of the things that we're going to be rolling out this week is transparency around our supply levels. So just making sure that our frontline caregivers can see this is our dashboard, whether we're green, yellow, or red. The good news is that we're green and we're working really hard to keep it that way. But if in the event that we're yellow or red, caregivers will be able to see the action plans and what's going to happen, what we're doing to keep it from falling into one of those categories. So so there's just a lot of work that we need to do to make sure that we can do this safely, because that's critical. And the other thing, and a lot of healthcare systems follow this as well, but just being a high reliability organization, we've been working on safety and quality for years. So it's just taking all of those same behaviors and just amplifying them and making it relevant to life in COVID. So, we have new policies around universal masking, on how to use N95s, on social distancing. And so if people aren't seeing that happen in their areas, just like you would in any high reliability organization, you need to speak up and say something. We need to hold each other accountable to make sure that all of this is happening. And it's reassuring for patients too, because if they come into one of our facilities and don't see us in mass, if we're not practicing social distancing, when we're not doing the direct patient care, all of those things send a message to patients about, am I safe here? So those are the things that we're really working on communicating and just making sure that we're all aligned around how we need to deliver care during this really just unusual time.
Yeah, it is so bizarre. There's a couple things you said I want to touch on. The first is the idea that we've done so much research on patient fears. And what we found is it's a really high level, though we're also hearing that, most health systems are seeing the people come back in. So I think there's a balance between the people who have urgent high acuity needs are going to come back. They're going to put their fears aside, but we're not seeing, systems return to 100%. It's 60% or 70% or 80% at best. Some of that is because, to the point you made earlier, you just can't get to the 100% that you were before with social distancing and PPE restrictions and that kind of thing. The other is there's going to be people that are going to resist, right? So it's so important, to your point. I got an email today. You used airlines as an example, from the CEO of Delta, and they are communicating nonstop. And it was a long email, and it was all about what they're doing to keep the planes clean, that middle seats are no longer an option. It was a very compelling email about what they're trying to do. And we need to do the same thing. So I think that's really important. The other thing is, I love the idea that you shared about the dashboard. So who would have thought that we would have needed a PPE dashboard, but internally, right? I can tell you from having experienced it firsthand, when the crisis was really at its peak, there was a lot of confusion in some hospitals and health systems from caregivers who maybe they personally couldn't get what they needed at the time, and that turned into a rumor that we're short of PPE, and the system's like, no, we're not short, but that person went out and said something on Facebook or social media. So the idea of transparency for that, to me, just has got to be so critical, both to put them at ease, because if it's all green, that's great, but also so they understand that, well, we're at yellow or red. And so you can see that, and you're going to see the changes in place if that's true. I don't know who else is doing that. I just think that's a great idea. Yeah.
That's what communications is at the end of the day.
So do you want to talk really quickly? I'll give you a choice because we're near the end of the show. We can go a little further than the bottom of the hour, but there's a couple other things we want to talk about. One was your CEO, who I think was a visible national leader before this, but has stayed out there. And the other is a initiative you had that's connected to PPE. You can touch on both of them. It's up to you. Depends on how far you want to go. You pick what path you want to go.
Yeah, I'll touch on both of them. So you asked me to talk about our CEO, Rod Hochman, and he has been, out there and vocal, about the crisis. He's just a really great communicator with a lot of really great perspective. He has a voice and he wants to use it. So, for me as a communicator, it's wonderful to be able to work with someone like that who has such a perspective. But, as I was saying, it's just, we really did feel like we needed to be out there communicating about what was happening, just because, we didn't feel like what we were seeing in the news was necessarily like what we were seeing on the ground. So we just needed to provide fresh perspective from a doctor, someone who's following science, and I can tie that to our 100 million mask campaign because, it wasn't just a rumor. Like, we were literally almost about to run out of masks, like a basic 75-cent mask. And to things that the entire economy of the entire country, was brought to its knees because we couldn't, the country didn't have access to 75-cent masks. That's insane.
Yeah.
But we, as I said, we saw these warning signs early since January. And for 2 months, we were trying to raise a flag saying this is going to be a problem. And so it wasn't until, that day where it was just we're days away from completely running out. And so we got to the point where, we'll make our own PPE if we have to. And, our CEO at the time said, people need to see this. People need to see us, what we have to do to, we shouldn't have to do this, but people need to see it. So, we were vocal about it, that we were going to launch this 100 million mask campaign. It was pretty incredible where we were, just the entire community just stepped up and wanted to help us. And the great news is that we had manufacturers, the top leading one being a furniture factory just north of Seattle, said, how can we help? And they literally within 24 to 48 hours just converted their entire factory into a mask making factory and just churning out all these masks for us. And then before we knew it, Nordstrom was on board and their tailors were helping us sell masks. And the Alaska Airlines, which is our hometown airline, was helping us deliver the masks to our different, getting them on planes, because the supply chain was so broken, even the lines weren't working quite right. So it was just this incredible effort. And since then, the American Hospital Association has taken the mask challenge and scaled it up nationally. So they're now connecting manufacturers to other health systems across the country. And it is one piece, we call it novel manufacturing. It is one piece of our strategy to make sure that we have enough PPE until the supply stabilizes. So it's still continuing and it's still an important piece of what we're doing.
Yeah, it is. It's just incredible to look back. Even in the moment, it was incredible, but to think that how could we not, I don't think we could have prepared for, maybe we could, but not been able to respond in a more cohesive way for something so simple, to your point, that it fell upon, the very people that are trying to deal with this in the front lines to figure it out. I know that Governor Cuomo in New York said he's going to put out something that says providers in New York are going to have to keep a 90-day supply of PPE just as a regular course of business moving forward. And so there's going to be those kind of things will come out of this, but that's a pretty incredible story that all those folks came forward, and thankfully they did.
Yeah.
Yeah. Well, Melissa, thank you so much for joining us. This has been terrific.
Yeah, it's been super fun. It's great to connect with you both.
Yeah, I really appreciate you spending time. Maybe we'll have you back. I don't know. I hope we're not doing this podcast in a few months. When we started this podcast, we said, this has got to be the first podcast that's been started where we hope it doesn't last very long, because we want to try to do this every day until the crisis is over. But I guess we're going to have to define what that means. Chase and I joke about that sometimes, but I sure hope we're not here in December and January talking about something else, like if it continues in some other way. So if we have you back, that'll be good to have you back, but also means we're still dealing with this thing. So we'll see. But thank you so much for joining us. Really appreciate it.
Thank you.
Chase, as always, sir, thank you.
Absolutely. And really enjoyed the conversation.
Yeah. Tomorrow we have Jared from Revive back. Jared's been a guest a couple times. We're going to talk about primary care again, dive a little deeper than we did yesterday, and talk about the impact on the primary care model of COVID-19, what may come out of that. Remember, if there's something you want us to cover, throw it in the chat channel now. Email me at cab@thinkrevivehealth.com. Just let us know. Remember to visit thinkrevivehealth.com for a recording of today's episode and all of our content. Subscribe on iTunes. Let people know about the podcast. And to all of you out there like Melissa and others that are working at hospitals and health systems, communications is so vital to getting your organizations through this, to helping your patients, helping us as a country get through this crisis. So hang in there. We know it's a really tough time for all of you. We're going to be there with you until this passes every weekday. So thanks so much for joining us today, and we will talk to you tomorrow.